Dr. Amy Duffy. I am the president of the North Carolina Integrative Medicine Society, and we have our Southeast Regional Integrative Medicine Conference coming up this year, June 14th and 15th in Asheville, North Carolina. It is a CME conference, and it's one of the most fun conferences that we put on and that I personally have been to. And one of my great friends, Deb Matthew, is the former president of the North Carolina Integrative Medicine Society and will be one of our speakers this year. So Deb, tell us a little bit about what you're going to talk about this year.
Yeah, well, I'm going to be busting myths about bioidentical hormone replacement therapy. So a lot of times when we talk about BHRT, we're talking about all the good stuff, right? We're talking about how if you have hot flashes, we can make your hot flashes go away and we can improve your energy and your mood and all the things. And that's great. And that's all true. But there are a lot of controversies in bioidentical hormones. And a lot of times we shy away from the controversies, but not this time. We are diving right in and we're going to tackle them head on. So we're going to be talking about what do you do if your patient comes in and she's 65 years old, she's never been on hormones before, and now she wants hormone replacement therapy? Or what if she's 75? Or what if she has risk factors for heart disease? Or maybe she's had a blood clot, or she's got one of the genes that predisposes her to having a blood clot, and her doctor told her you can never have hormone replacement therapy. What are you going to do with that one? Or if she has risk factors for breast cancer, or her mom had breast cancer and her gynecologist said no hormones for you, but she really wants to be on hormones because she read somebody's book or heard a podcast or her best friend is on them. What are you going to say to her? So we're going to go through the data to look at what the research actually is, because a lot of times what the research says and what's sort of commonly known in the medical community are not the same things. And we're going to talk about how to make reasonable decisions, because we don't want to put our patients at risk, but we also don't want to put our medical licenses at risk. So whatever decisions you make based on what you believe the medical science says, you also want to do it in a way that's not going to get you into hot water. So lots of controversy. I think it'll be interesting. I'm kind of looking to stir up a little bit of fuss and bother, because that just makes it more interesting.
That sounds fantastic. Can't wait to see you there.